This morning I'm joined by longtime journalist Pete McMartin. He's a journalist, now opinion columnist for the most part with the Vancouver Sun, has had a long career as a journalist and is semi-retired, but still writing pieces that are getting quite a lot of attention. And his latest one has done exactly that. So I'd like to welcome to the podcast journalist Pete McMartin. Pete, thanks for joining me today.
My pleasure, I think.
I appreciate you taking the time. Listen, just to set the stage for listeners, Pete and I had a discussion yesterday around an article he had written. We had some disagreements, and I always say on the podcast, I think it's important to have discussions, even around issues that we disagree on, and see different perspectives, and maybe we can find some common ground. But before we do that, Pete, I just want to set the stage a little bit for listeners, a little bit for myself as well, introduce you. Can you just briefly take us through your journey to working in journalism and why you chose to come into the field?
Okay, well, I grew up in Windsor. Lower middle class family, worked in the car plants, saved up enough money to go to Ryerson journalism program in Toronto. I was always a reader when I was a kid. So I, gravitated towards literature and writing. So it took me to journalism, and I was hired by the Vancouver Sun before I graduated at Ryerson, sight unseen, and I had never been outside of Ontario, and flew to Vancouver, joined them, and became a reporter. Then I was promoted to columnist, and I wrote a column for about 35 years. For the first decade or so, it was daily, almost killed me. And then it was 3 times a week, and then retired about 7 or 8 years ago. The year after I retired, my editor-in-chief called me up and said, we'd still like you to write for the newspaper, whatever you want to write about, no deadlines, and that suited me just fine. So I write maybe 1 or 2 columns a month now.
So that sounds like the opposite kind of challenge that many journalists are having, in the sense that so many layoffs, and your editor's calling you, asking you to continue writing when some people are really trying to hang on to their jobs. Why do you think it is that the Sun really wants you to keep writing with them? I know it's speculation, but.
Okay, well, you speculate. Go ahead.
No, I'm wondering what you think. You know so much better than me as to your relationship with the Sun.
Well, I guess they like my writing, and they figure that I can attract an audience still.
Yeah.
And I was never shy about what I thought.
Right.
And I guess that's why they asked me back.
Yeah. So your writing, perhaps, gets people talking, gets attention, brings conversations forward.
I think that's what all journalists try to do.
Yeah. So now you're doing the 2 columns that you're doing per month, 2 to 3 columns per month, opinion pieces.
Yeah, mostly, in slices of life. Sometimes I write about myself, my family.
Yeah.
I write about anything that strikes me. The last column before this was I wrote about a pair of eagles that were nesting in my backyard.
Oh, cool. Okay. Yeah. So really, whatever you feel like writing about, that's pretty neat.
I did a piece on Mark Madriga and Christy Gordon. There were the meteorologists with BCTV who have exactly the opposite opinion on global warming.
Okay. So this that leads us to opposite opinions. This is what really our society is dealing with right now, but on an intensified level, in my opinion. A lot of division, especially around some really core issues here in Vancouver. You agree? A lot of division currently?
I would say on social media, where it is magnified, because you get trolls, you get people who basically live in social media. I don't. I read what people say when I write a column. I will read the comments on social media, and that's where you find a real, I wouldn't even call it a divergence of opinion, just just people spouting off.
Yes.
But I think when it comes when you're in people's homes, day-to-day opinion, I think it isn't that divisive.
Okay.
And that's what I have found when I get personal emails rather than people anonymously on social media. When people actually give me their names, or when they talk to me, or when I talk to them face to face, I don't see that real vituperative divergence of opinion.
Yeah. Well, I think sometimes you're right. There are the ones that just want to post anonymously, and when it comes to having real dialogue, they're not interested. And then I don't know. I believe there are others who perhaps are maybe afraid to speak up on one side or the other. Of an argument. I know a lot of family dinner tables. People go. The wine goes across the room, and one family member goes storming out because of political opinions or differences or things like that. But um, I know in Vancouver, for sure, there's been, differences of opinion around the downtown east side, and that's what we're talking a little bit about today.
Right.
You wrote a recent article. I'm going to link to it here so that people can read the article, and I highly encourage you to read the article before kind of continuing watching the episode, because I think that really is important to see the actual content of the article, so that you can, really understand what we're discussing here. The title of the article is "The Law Protects the Rights of the Most Vulnerable Among Us to Live in Filth and Despair." Pete McMartin, and the subhead is "I'm tired of how homelessness and addiction take up so much oxygen in the social discourse." And it continues on, and I encourage you to read the full article. Reading half or a small piece is not the article. You have to read the whole piece. So I posted on my LinkedIn that I respected your free speech, and that I think it's important that we all communicate how we feel. But that I was bothered by parts of your piece, specifically the piece on the subhead here. Actually, I'm tired of how homelessness and addiction take up so much oxygen in our social discourse. Would you mind summarizing kind of why you wrote the piece, the messages you wanted to convey? Let's start there.
Well, I wrote the piece after reading several things in my own newspaper, which I heartily disagreed with. One of them being Sam Sullivan, who former mayor and former council member of Vancouver City Council, who said after God knows how many decades, he came to the conclusion that the experiment, as he called it, in the downtown east side has failed.
Mm-hmm.
And I thought, you were mayor during that time, and you were a council member during that time, and it's only now that you've come to decide that it's a failure. It was apparent to me that the downtown east side has been a failure from the very get-go.
Mm-hmm.
That, as I said in the column, it was a sort of an unspoken thing between the different levels of government that concentrated some 300 social services in the 8 square city blocks of the downtown east side, which
Yeah.
is ridiculous.
Mm-hmm.
And at great cost over a 5-year period. Well, I'll get to that in a moment. But what the way I saw it was that these social services were barricades, and they ghettoized a population of addicts and homeless people in those 8 square blocks. And I think the public at the time was complicit in this. They were happy that, okay, if they stay there, out of the way, fine, everything's good. And then fentanyl and the opioid addiction hit. and people started to die, and people started to go out of the downtown east side, to the point now where you get homelessness in White Rock, you get it in Surrey, you get it in Burnaby, you get it in my suburb of Delta. It's everywhere now. And I've been getting emails from people saying, I live in Burnaby and I'm picking up needles in my park so my kids don't step on them. Mm-hmm. Yeah, it's a disaster. And we have done the same thing, tried the same things over and over again, spent billions of dollars on this problem, and nothing has changed. So that's why I wrote the column. And I just said, I'm not, it would be a mistake to read the column and think that I am unempathetic to the homeless and the addicted. I have spent my entire career writing stories about the downtown east side from time to time. 40 years of writing stories about the downtown east side. Interviewing addicts, interviewing homeless people. In fact, I spent a week living in the downtown east side just for a story in an SRO. So I know, the very difficult problems of people living not just in that area, but people who need help. But we have talked about this so much. We have tried so many things, and none of it's worked. And I just thought, well, I'm gonna say it. And what I found was, from at least 95% of the hundreds of emails that I have received since the column has ran, of people saying, "Thank you so much for saying this. I've been afraid to say it," because they don't want to seem unempathetic. And that's what surprised me, that people were afraid to talk about this. Not that they're, not that there's been enough conversation as you maintain, but that they've been silenced into this kind of, I don't know, political correctness, that they can't say what they feel.
I have a problem with that. I think, and to my point, and I hope that it was seen that way in my post. I think that there's a real problem with people feeling as though they can't speak up one way or the other on whatever issue it may be. That's definitely a problem. I wanted to know, thank you for that summary on why you wrote the piece. My feeling, and it's no secret, I have struggled with mental health challenges in times in my life, spent a little over a decade running a business, kind of living a double life, so to speak. I was prescribed opioids for a back injury, which led to substance abuse. I was buying drugs on the downtown east side and dependent for about 12 years. Now it's been about 8 years since then. So I'm blessed to have found a way out of that. I've never been homeless, but I do have I feel as though it is my place to advocate for those who, feel lost, who feel like there's no hope in their addiction, who are homeless, who are judged. There's a lot of judgment, a lot of stigma, a lot of stereotype around this, which is separate from the article you wrote. But the one piece that I wondered about, Pete, is that, at one point you said just now, we've tried the same things over and over. And another time you said we've tried so many things. So I guess what I'm understanding from that is both. We've tried the same things over and over, and we've tried a lot of different things.
Well, it's a package of services. When in the column, I talk about a survey that a reporter who Laurie Culbert and I did some years ago, well, decades ago now. And we found that in those 8 square blocks, there were some 300, I haven't got the exact numbers right now, but some 300 social services that cost taxpayers $360 million a year just for those services, including a food bank for pets. 5 years before we had done that survey, a reporter at the province by the name of David Carrig did exactly the same thing. And he came to the conclusion that there were a little less than the number of social services that we had found, and a smaller number of people being served by them. So what that meant was, in those 5 years, there were more people being, there had been a growth in the number of people being served by these services, and there had been a growth in the services at $360 million a year, which adds up to, over those 5 years, and this was decades ago, $1.85 billion a year in 5 years.
Right.
Over $1 billion. And anybody who says that, there have been successes down there, well, there might have been individual successes, but in total, it's been a complete disaster. And it deserves to be said.
I don't disagree there.
Some people have been saved, but the year after we wrote that survey, Perry Kendall, who was the health minister at the time, I believe, declared a public health emergency because of the number of opioid deaths, as you're probably well aware. And since that time, I think there have been, was it 1,600 people died, or perhaps more? Was it 16,000? I'm not quite sure.
16,000 in BC, yeah.
What's that? 16,000? Yeah, it was, that number was in the column too. And as I say in the column, that's not progress. That's a plague. Yet here we are. We have this social. I think we have this social mort that we have a very strange attitude towards drugs, and I think it's kind of been a backlash from what happened in the 60s and 70s. Where
the war on drugs.
Yeah, but there's been a complete. To me, it's becoming kind of, we're aiding and abetting drug using now, and we've seen that in the medical profession, as the prescription of opioids to a lot of people that killed a lot of people. And I think overall, there has to be a shift, a real seismic shift in societal mores about how we think about drugs and how we think about the treatment of drug addiction. And I'm not just talking about, I think I'm talking about a move towards a more conservative mindset. And I'm not, I don't want to get into that thing about liberal conservative, but I think we had to think in terms of, this is hard to describe in words without me sitting in front of a typewriter. But I think we've gone too far one way, and we have to sort of retrench our ideas on substance abuse. And I'm sure I'm not making myself clear here, but
no, I think you are. I think it makes sense. But what we're having now is public discourse, which could actually result in a common ground and perhaps ideas. And that's why when you're saying that, the piece that I was, upset with was, feeling as though homelessness and addiction take up so much oxygen in the social discourse that this kind of conversation, to me, this is a systematic failure by the government and by the health system, government on many levels. These things have not worked. And therefore, my feeling is that we need to continue to discuss it, because the problem is, as you describe, a plague. And if we have a plague, we need to continue a discussion in order to find solutions that do work. That was my feeling on it. What are your thoughts on that?
Well, I think, yes, we should find solutions. The problem is that under our current system, and I'm not saying it is wrong, but under the current criminal code and the Canadian Constitution, it would be very, very hard to what many people would see would be the impingement of a person's right to take drugs, to harm themselves, to live on the streets. And that is, to me, an almost insurmountable problem. I think people, not just in the downtown east side, but people who are living on the street, many people argue, well, it's not just because of drugs, but people who are self-harming, I think, need to be taken out of that environment, especially in the downtown east side. You cannot have that concentration of social services. And I think find solutions for those people. They need to be taken out of that temptation. Like I get an email from a guy who actually had he ran a service in a hotel, and he said what would happen was that the people living in the hotel were allowed to shoot up in their rooms, and what happened was, over a period of time, the rooms became totally trashed. And this has happened not just in this guy's place, but all over the city. And, the rooms get trashed, the places get condemned, the people are out in the street. So there has to be some kind of, I think, involuntary treatment. I think there have to be camps or some kind of facilities set up away from the temptations of the downtown cores, where people can try to get it together, and then when they feel that they're ready to go back into, a civilian life, take it from there. But as it is, it's just not working.
Yeah. No, I agree it's not working. I do believe, and just as we kind of wrap up in the next few minutes here, I just wanted to know your thoughts on harm reduction, because that I do believe is working. First Nations Health Authority in 2024 came out with a variety of data. Indigenous peoples are, as you well know, disproportionately affected by opiate deaths. And 2024 toxic drug deaths decreased by 6.8%. Toxic drug poisoning is down 8.6%. And they attribute this to a variety of lists, and I won't read it, it's in length, efforts they made years prior in harm reduction, such as opioid therapy, such as, Suboxone and methadone, sessions with psychiatrists and addiction doctors, grants for naloxone kits, et cetera, et cetera. So, harm reduction to a point, do you believe that there's a middle ground here where we can, incorporate harm reduction without perhaps what you're describing as going too far the other way on the pendulum from this ineffective war on drugs and prohibition kind of approach to where you feel it's on the extreme other side?
Well, I would ask, where did harm reduction get us in the first place?
Well, it saved my life, that's for sure.
It might have saved your life, but it didn't save a whole lot of others.
But the problem is, Pete, is that it saved so many lives. I mean, I can myself just sit here right now and list 100 people I know, and that's one person. So harm reduction works.
Uh, okay.
Not for everyone,
This
but
is
it works.
yes, not for everyone, and this is where I'm talking about this. There a societal shift that we don't need, that we shouldn't need harm reduction. I, I I thought in the beginning, to me, harm reduction was a catch-all phrase that allowed more drug use. That if that sort of legitimized drug use, and I just don't think it works.
I
I
guess
mean,
there's various levels of harm reduction
I
too.
think it's a stopgap measure, and I think there has to be, as I said, a societal shift in these things.
Okay. Well,
Yeah.
that's that. Yeah, no, that's fair. I think we'll agree to disagree on that. I also think
Okay.
there's different levels of harm reduction, right? We have Suboxone, which is very different than harm reduction of an injection site, for example, a safe injection site. Those are two very different things at different levels. So
Which
perhaps,
I don't agree with. I don't agree. I don't think there should be safe injection sites.
what about Suboxone and other?
I, I don't. It's such a it's a labyrinthine subject.
It's a layered issue. I do understand. It's hard
Sure.
to answer its questions.
I just, as I say, I just think it's gone too far. I think I'm just going to leave it at that. I'm sorry.
Mhm.
You know, to me, harm reduction was the beginning and the end.
Okay.
I'll leave it at that.
Okay. No. I think it's fair that we did agree to disagree on that point. Um, Wrap up by saying I do agree. When I'm with my children, when we see needles in the streets, like I said to you yesterday, it upsets me. Um,
I should
it just
think so.
it disturbs me. And I think there's sometimes this level of thinking that those people who support harm reduction, support certain levels of behaviors that we do not. And I don't speak for others, but I speak for myself. But I guess what I hope, Pete, is that discussions like these can happen, and that we can remember that at the end of the day, uh, you and I are, we're not living in mansions. And I mean, I rent with my 3 children and my husband, and I'm sure your situation, we're not, but we're privileged compared to most of the world. And that, it is a certain job to
yeah.
help
Wait
others.
a minute. I don't count, as you say, being privileged as something either ashamed of in this context,
Oh,
or
no,
that you're not allowed to express an opinion in this context. I think
no.
that's but wait a minute. I think this is part of the problem. That we better stay out of this conversation because we have we're safe. We have good lives. Sorry, I don't agree.
I don't either.
I have, as I say in the column, I feel that my right to be insulted by the fact that people are crapping in the streets and leaving their needles is subsumed to their right to do it. That they're more protected in their right to do those things than I am to be upset about it.
And I agree with that. I think what I meant, privilege has nothing to do with having an opinion. We all, privileged or not, have equal opinion. I think as privileged people, we have a responsibility to do what we can to help others who are less fortunate. That was where I was going with that. Has nothing to do with expressing opinion.
And we have done that in spades. We have done that in billions.
You stop?
And I feel that people that are in this business of whatever you want to call it, social services, use that idea of being privileged as a form of censure, that you have no right to speak on this issue. And that's why,
unfortunate and wrong.
well, maybe, but I think that's why I've got so many messages from people saying, thank you for saying this. I've been afraid to say it. So, yeah.
No, point taken. I mean, I think if that's the way that you're feeling and others have expressed their feeling, that's a problem. Everyone should be able to speak, and it should have nothing to do with their privilege or not. I speak to privilege in the context of supporting and helping others, not if it's expressing opinions at all, or expressing how they feel, or whether it be against this or that or for this or that. But I do agree. I think there's a real problem when you feel as though just because you have privilege, you can't have opinion or you can't express opinion. I think we should all have equal space to speak our points and not be attacked, not be judged. And that's how I feel about that. And do we agree on that?
Yes, of course. That's what I do for a living.
Yeah. But would you then agree that, that I have also the rights, as another privileged person, I guess, to voice my opinions about, how I feel that we should continue to discuss this and help to support, right? We all have that right.
Of course, but it's how we support those unfortunates is where we may disagree.
Right.
And I think that a lot of people feel that they don't have the right to disagree.
No, that's not good.
That they will be branded as, neo-fascist conservatives or something like that. And I think that's ridiculous.
I think disagreements are where we might actually find solutions.
Okay.
What do you think? Maybe.
I don't know. I would hope that governments take a relook at this problem. I think that it's going to become a political problem for a lot of politicians who live in, say, the suburbs. I think people politicians in the downtown have lived with this for a long time, but I think it's going to become a real issue out in the suburbs where the seats are, where governments are made.
Right.
And it's going to be a completely different outlook out there.
Pete, I appreciate you taking the time today. Please read Pete's article. A lot of people have. There's been a lot of discussion around it. 2 things I want to say in closing. 3, actually. Pete, thank you for being here.
Oh, let me say one more thing.
Sure.
Because of the number of emails that I've got, many from people who work in social services and police and just civilians. I'm going to be writing a second column on this, on the response I got.
Watch for Pete's second piece on this topic. I wanted to thank you for being here. It was clear on our phone call yesterday that we had some disagreements and difference of opinion.
I didn't feel that.
Maybe I'm a bit more sensitive than you are. But I do appreciate you being here and sharing your opinions, and I value them and I appreciate them. And I want to think about them and evaluate them. Second thing I wanted to say was that I think that we need to really learn one thing from this is that everyone has the right to voice their thoughts and opinions without feeling as though they are going to be attacked, judged, canceled, whatever it may be. Of course, that's to the degree of, sensibility, not hurting others.
I agree.
And that's important. And the other thing is that, my hope is that people like myself who really do care very deeply. It's one of my primary, other than ADHD and neurodiversity via my young son. It's one of my primary advocacy areas due to my lived experience and many friends and family who have gone through mental health and substance use challenges, that our voices are also heard and respected as equally as those who have different opinions on it. And through that, I believe that if we can kind of come together a little bit more, we might actually find some common ground. And you might see maybe one day, Pete, you and I will actually sit and say, you know what, Rachel, I think we found an agreement here. You never know. And then you'll write a column about it.
Oh, man. Okay.
Promise me you'll write it.
I'll try to be fair, but who knows,
I'd like to thank Pete McMartin for being here today. Journalist, opinion columnist with Vancouver Sun, took the time to come on chat today, knowing we have differences of opinions. I appreciate that. Thank you so much for your time today, Pete.
All right. My pleasure.
Take care. Bye-bye.